Good afternoon, everybody. This is Governor Beshear's office.
Good afternoon.
Hello.
I'm going to transfer you to the governor now.
Hello, everybody.
Hello. Hello, Governor.
Well, thank you all for taking just a little bit of time. Wanted to have an opportunity today for you all to learn about our contact tracing program and to introduce you to Mark Carter, who is going to be helping to run it. As we look at going from healthy at home to healthy at work, and us all desperately in the fall wanting to be healthy at school, it's important that we understand and promote the tools that it's going to take to manage those types of steps in the midst of this crisis. And you all have already been so instrumental in addressing this crisis. Everything from helping us to stop the spread based on your decisions on your school systems, to helping our kids to make it through this, through NTI learning, through schedules, and through all of the help that's been out there, and through the millions upon millions of meals that you all have served. You have been incredible leaders. And you're the type of leaders that when people look to, a lot of the politics that the different folks may try to put into some of this stuff fades away. That you all are leaders that people look at and trust, and I think know that you're just doing the very best you can for our kids, and that credibility is really important. It's important because the testing and tracing are the only two ways that we can ensure that we reduce the spread of COVID-19 until there is an ultimate vaccine out there. And we need people to understand and to trust the system. So as we move forward, there's going to be two challenges, but they are very different challenges than we've had thus far. The first is going to be ensuring we have enough people being willing to be tested on an ongoing basis. That's to ensure that people aren't bringing the virus into your schools or your places of work. We now have the capacity in locations all across Kentucky to test 2.5 times the number of people that the White House thinks we need to for it to be safe. So we have the testing capacity out there to truly try to address COVID-19 as we move forward. But testing only tells us where the disease is. Tracing helps us to stop the spread of it once we identify it. And as Mark will walk through, we are developing this system in a way that protects people's privacy. We're not out there tracking the movements of Americans. I know that there are some in our state that are about to start trying to make those arguments in an effort to sow dissent more than anything. But it's a chance to just know who that person that is tested positive comes into contact with so that we can mitigate that spread and so that we can ensure that other communities, other areas, other schools, other school systems aren't impacted if we have an outbreak moving forward. And as you can see by some of the news coming out of France, we ought to expect as we go forward that we will have regional or local or even building-wide outbreaks at different times. To identify those, to be able to trace who folks have come into contact with allows us to kind of form a bubble around that group, make sure we get everybody healthy, provide them day-to-day services, including medical services, food, and other support, and then to ensure we get everybody healthy and back up on their feet. So we wanted to make sure that you all could hear directly from Mark Carter about how we're going to do it. And I know for all of you that are more savvy than I am and could connect to the Zoom, he is going to even be able to walk through how the tool works. This is our goal, to be really transparent, because if there is a positive in one of your schools or in your administration, we are really going to need your help. We're going to need your help to ensure that we know everybody out there that could be sick so that we can help them and so that we can provide their support. And for the real possibility that there is maybe a school-wide outbreak, that we can limit it to that one individual building or school and hopefully move on in other places unimpacted while we get everybody healthy. Now, I know that sounds a little bit scary. That's going to be our world moving forward, but that's why we're developing these tools to help address it. So Mark Carter has a long history. Most recently was the CEO of Passport, an in-state multi-million, maybe multi-billion dollar MCO in the Louisville area. Brings both the CEO and the health experience needed to ultimately manage about 700 folks, but also think about all the different people and groups that we're going to have to work with as we navigate through this. And he's got some real talent there. So I think you're going to find he's approachable, he's collaborative, and he's the right person for this job. So with that, Mark Carter.
Thank you, Governor. And thank everyone for spending a little bit of time with us on this critical topic. As you all may know or may not know, I was sort of happily retired until last Thursday, and I answered the call from the governor to join Team Kentucky to address the COVID crisis that we face. I feel very strongly that we do need to reopen our society, and we need to do that in a way that's careful, and I think the testing and tracing is critical to that. My own personal view of this is just like I think every one of you, if I became infected with COVID-19, I'd probably be fearful, not for my own health, because I would probably be resolved that I would beat it. But I have 6 grandchildren, 3 children. I have an elderly father. I have many friends, and I would not want to infect them with COVID-19. And I would be very fearful of that. And so what contact tracing is really designed to do is to help me prevent that from happening to one of my family members, neighbors, friends, etc. So that's why I'm in this. I'm very pleased to be part of the public health infrastructure in Kentucky. We have great local health departments, and I know each of you likely work with yours. And I look forward to working with all of you going forward. I thought what I would do to introduce the topic and to give you a little bit of background and education around what we're going to be doing would be to first show a short video that we've prepared that sort of illustrates the way this work will be done inside your local health department and the Department of Health. So we're going to show that first, and then I have a few slides I would like to go through with you, and then we'll have time for questions and answers. Michael, will you roll the video?
To minimize the spread of COVID-19, public health workers need to know about exposures to make sure that all Kentuckians are safe and supported. We are using Kentucky's contact tracing and tracking system to help our disease investigators and contact tracers to gather the necessary information. Let us take the example of Sarah Smith, who is a disease investigator who starts her day by looking at a list of cases to act on. These cases are individuals who have tested positive for COVID-19. She picks up the case of Bobby Rim. Sarah reviews details about Bobby. She calls Bobby and begins the initial investigation. The system provides call scripts so disease investigators can be consistent with their messaging and make sure they do not miss any important information. Sarah confirms Bobby's symptoms, understands his needs around food, housing, and childcare, and finally, Sarah helps Bobby retrace his steps to document who he may have come in close contact with and which public settings he may have gone to while he was infectious. Among those people is Jan Johnson, who is Bobby's coworker. Once the call is complete, Bobby is directed to isolate since he is positive for COVID-19. To assist Bobby in recovery, the system automatically sends an email with helpful information. Sarah follows up with Bobby daily to make sure Bobby is okay and address his needs if they have changed. Once Bobby recovers or is no longer infectious, the case for Bobby Rim is closed. Once investigation is complete, the information is handed off to a contact tracer. Contact tracers are public health workers. Contact tracers such as Fred notify individuals who may have come in contact with Bobby, such as Jan Johnson, who works with Bobby. Fred calls Jan and notifies her of potential exposure to a COVID-19 patient. Fred is provided a call script to assist in gathering information he needs from Jan. Fred confirms demographic information, asks Jan if she has been having any symptoms, and gathers basic medical history. Based on Jan's responses, the system sends a tailored email to Jan with helpful information. Fred follows up with Jan daily to check on her symptoms and understand her evolving needs for support should she start noticing symptoms. After Jan's exposure timeline has expired and she hasn't encountered any symptoms, she gets an automated return to work email. To protect patients' confidentiality, case contacts will not be told the identity of the person who may have reported them. They will be told what they need to do to care for themselves, reduce the risk to others, and protect their communities from any further exposure. Contact tracing and tracking combines public participation and the power of technology to help public health officials and private healthcare providers contain the spread of COVID-19.
Okay. Mike, if you'll load the PowerPoint, I'll walk through the slides briefly, and then we can open it up for questions and answers. Okay, let's go to the first slide. This just depicts an overview of the contact tracing process and what its objectives are. It obviously is to prevent the spread of COVID-19. We have, at the Department of Public Health, for the last 4 weeks or so, have been highly focused on deploying an online tracking system. The Commonwealth has been working with Deloitte, an international consulting and technology firm, to stand that up. And I'm pleased to report that today we had our soft launch, which means that it's sort of a test launch that we're doing with a few health departments, essentially to make sure that the technology is going to work for our tracers. And then on the right there, you just see a summary of what we're going to do to try to help individuals prevent the spread. It's really, as I said, I'm an advocate for reopening our society and the economy. I know the governor is highly focused on that, but we have to do it safely, because if we have a significant outbreak here in one of your communities, it's just going to be a setback that may be much harder to recover from. So those are the overalls. Let's go to the next slide, please. This just sort of shows the roles and responsibilities. There are 3 positions that we are hiring for. We have onboarded a number of regional coordinators that will be working throughout the state with the local health departments on this process. And then there are three types of folks that we're hiring currently: disease investigators, contact tracers, and social support coordinators, each of which will play a role in the tracing process. I think the disease investigator and the contact tracer were very nicely presented in the video. The social support coordinator is really focused on trying to make sure that if folks have to isolate or quarantine and they're unable to work, that some of their daily needs are met. So if they have food needs, if they need help with their employer, those kinds of things are the things that the social support coordinators will focus on. Just next slide, please. With communication in any crisis, communication is a real challenge, and I think that we've put together a number of communication mediums and collateral that we will be getting out Much of this will be available on the KY COVID-19, ky.gov website, but will also be distributed through the health departments and other channels throughout the state. These are just a few examples of the type of collateral that we'll have disseminated. Next slide, please. In the end of the day, we all play a role in this. Obviously, the Kentucky Department of Public Health and the local health departments are the infrastructure for this, and the coordinator and that sort of thing. But we need a lot of help from the public, and that's where I think you can help with your constituencies, the influence you have with parents and the like. And these are some of the things that you can do to help prevent the spread of COVID-19. Just support the local public health worker or the state public health worker that might be contacting folks, and help them understand the importance of answering those questions. And I believe if you relate it back to family and friends and protecting them from the disease, I think that's an effective way to communicate. Spread the word locally. And please watch our COVID-19 website and Governor Beshear's social media accounts for daily information. I think that by doing this, that we can have it both ways in a initially measured manner, but eventually, schools will be reopened and the like, and it'll be critically important that we do this well. And next, I think that concludes my presentation. I don't know, Governor, if you want to moderate, or I'd be happy to.
Well, I quickly want to open the call to our Lieutenant Governor and Education Cabinet Secretary, Jacqueline Coleman, and then we will take questions. But I figure we would let the active educator among the three of us make sure that she corrected all of our mistakes.
Amen.
Well, thank you. And to everybody on the call today, thank you all so much for joining us. We have continued to talk through the difficulties and hurdles that might exist in returning to school. And we are in-person classes, I should say. And we are really committed to making sure that the plans that you create at the local level for all of the different scenarios that might exist are heard, and we want to make sure that your all's input is included as decisions are made, because you obviously know what's best for the kids and the folks in your community. So know that your voice is important, and we appreciate that you're on here today with Mark and learning about this new normal that we're all about to step into. And again, if there's anything that the governor or I can do to support you all, I hope you all know that we will do everything that we can. So thank you so much.
So, Mark, why don't we open it up to talk about contact tracing, or we can probably take a couple questions on other things. I've got about 5 minutes, and then if you can stay on a little bit longer, that might be helpful.
I can do that.
Governor and Dr. Carter, this is Kevin Brown at KDE. I just wanted to, we had a lot of superintendents and other participants that had to call in instead of accessing the video, and so we're going to, with your all's permission, either send the recording and or copies of the PowerPoint and the video to all participants after the conclusion of the webcast.
Absolutely.
Kevin, you want to open it up to any questions, or if everybody's got it, we can understand that.
Happy to take some questions. We know your time is short, but the superintendents are usually never shy about questions. So
I'll be glad to chime in. This is John Ballard in Elizabethtown. Just a quick scenario, and maybe you could kind of help us understand a little better with this. But let's say we have a high school student that has 5 or 6 classes of 20 to 25 students each, plays on the football team, rides the bus home, and later we found out he tests positive. How then are we to contact, or who contacts those 120 to 150 students that he's possibly come in contact with, and are they then quarantined, and what happens at that point?
Well,
Let me answer part of that and then turn the other over to Mark. What people are going to be asked to do will depend on their closeness and proximity and the duration of the time that they are around an individual that is tested positive. And so that's something that'll be clearly communicated to each person. Mark, if you want to talk about how the communication works.
sure. The communication is with initially with the patient, a young person, and that's the role of the disease investigator. The contact tracers will be the folks that will be contacting individuals who have been exposed. And John, on the area of in school, each of those contacts will be evaluated on against a risk scoring type algorithm and arrayed between low, medium, and high. And depending on what the exposure is, that will drive what has to happen with the individual that's come into contact with the student. So, if it's just if he rode on the bus and he sat in the back of the bus and the other student was in the front of the bus, that's going to be assessed as low risk. If, he was playing football and, was a guard trying to block the nose guard, that's going to be higher for 3 hours in practice. That's going to be higher risk. And so there will be different protocols for each one of those. I'll have to get back to you on what the protocol will be as far as working with you in terms of the school. We will certainly be doing that, but we're still working through some of the details on how that's going to happen and are completely open to suggestions from you all on how we do that.
I have a question. I didn't know whether anybody saw my hand up or not. I'm Julia Preziosi, and very unique situation here. I'm both a child care facility and the executive director of a private nonprofit accredited Montessori school in Kenton County. I have two questions. The first is around testing, and it was my impression that testing is still not widely available for asymptomatic individuals, and I feel like that's going to be key in stopping COVID at the door, so that at least all employees can be tested prior to school starting. And then my second question is relative to liability issues around HIPAA laws, and maybe unique in the fact that I am running a private school whose stakeholders may feel differently about these things. So I want to thank you, first of all, for allowing me on to this call. It's been very valuable, and I appreciate thoroughly the activity of the governor during this time. Thank you very much. I'll go on mute now.
Let me start on the testing. We are now to a point where we not only have available widespread testing for asymptomatic people, but we want more of our general population tested. In Northern Kentucky, we have, I think, 2 drive-thrus working with St. Elizabeth's right now. We have Kroger drive-thrus in 4 other locations. We have Walmart's testing for asymptomatic folks starting in 6 places. And then we have local health departments and other hospitals across the state. I think we now have over 50 different sites. But there is now, it's not a capacity challenge, it's a logistics challenge, both getting the information to people and encouraging them to get tested. But we can direct you to a testing location for all of your employees, and we would really encourage you to do that. There's also all the first cares across Kentucky that will do it at no charge to the employer or to the employee, but they have ways that they can bill Medicaid, Medicare, and the rest. On the liability side, I think we need to get some of our general counsel folks on. I'm told I shouldn't play lawyer anymore. Now I'm governor. But there, I think when you look at liability, it runs a number of different ways. Also about the need to notify other students and other parents to ensure that an infection that could have been controlled is. But there are, I mean, HIPAA has certainly been altered during this crisis, and there's a lot of leniency on how you do it. Our way through our contact tracers do not identify other individuals when talking to people. Now, a lot of time in a small community, you can figure out who that is, but you can do that HIPAA laws or not.
Thank you very much. I appreciate that.
Thank you. We appreciate you. And I know these are challenging times and challenging decisions, and I'm sure in y'all's position dealing with parents sometimes can be challenging too. I could say that being someone who serves them all as constituents. I got to jump off. I will leave more questions to Mark. Again, thank you all for your leadership. I know we all want to do the right things. Sometimes we may think those things are a little bit different, but we all want a world where we are safe with our kids going to school until we get that vaccine and get back to an old normal. So thank you all very much.
Dr. Carter, this is Kevin Brown again. We have several questions over in the chat. The one mentioning contact tracing in conjunction with testing, and are we looking into pooled testing?
Give me that question again, Kevin. And I'm not a doctor, although I appreciate the field promotion.
The question is, the governor mentioned contact tracing in conjunction with testing. And so the question is, are we looking into pooled testing?
Well, the short answer is that we are, but I don't have a lot of detail on that I could share at this time.
I'll ask our KDE folks on there to flag that for when we get follow-up from.
Yeah. And Kevin, we are recording all these questions, so the ones that can't be answered today, we will follow up to get answers.
The next question, is it okay if I just read these? And
yeah.
Because I think this one's I can help answer. Continuing NTI long-term with paper packets creates unequitable education service for students who do not have access to technology. What support is there for schools to defend against claims of state denial of FAPE for schools continuing to prohibit in-person classes for students? We anticipate that we will have kind of a hybrid situation in the fall. There may be a need to have some students out of in-person classes and some students in in-person classes for various reasons, social distancing, or if the student and or guardians and parents don't feel comfortable sending their student due to the compromised health conditions of someone in the household back into a school environment. And so we do believe there is going to be a need for districts to continue with some type of non-traditional instruction. Districts do have funding available to them under the CARES Act that can be utilized to purchase technology. We have some cooperatives looking into how they can facilitate hotspots in certain parts of your districts to assist with technology delivery. The denial of FAPE is a claim that is made even in a perfect year with some students, and I don't want to begin for a second to say that those claims would not be raised, but I think the best thing for us to do is to continue to perfect the non-traditional instruction, utilize the resources we can and have available to us, particularly the one-time federal resources to try to get particularly technology resources into your students that don't have them. That's part of the answer. I know it's much more complicated than that. And we're going to strive over the summer to continue giving guidance to district as to what that looks like. The next question, Mr. Carter, I think is you all can certainly answer, and we're getting this question a lot. Should all districts be planning for and purchasing personal protective equipment for all students and staff And will masks be a non-negotiable for all regardless of when in-person classes will begin in the fall?
Yeah, so my singular focus has been on contact tracing. This is my fourth day on the job. Kelly Alexander is on the call. I don't know if we have an answer to that yet, or if that's going to be guidance that's given out in the coming weeks.
Well, Mr. Carr, we do know that Public Health will be issuing more specific guidance. If they haven't already this week, it's coming, I'm told, really soon. And we're having Dr. White on the superintendent webcast on Tuesday. And I know this is one of the questions that she will be ready to answer. So for superintendents, you can just hang on for that answer for on Tuesday.
Okay.
There's another question here. I think that we'll need to defer till Tuesday about social distancing on buses.
Mm-hmm.
Another good question. And then a question about testing, whether if we're to test all employees to re-enter school, should we require that be done on students?
Well, if it's okay, let's defer that one for Dr. White also.
Do we have any other questions from superintendents or other participants on the contact tracing issue program?
Kevin, I would certainly offer that if there are questions on the contact tracing aspect, feel free to direct those to me or any of the leadership here at the Kentucky Department of Health or your local health department. I think if we don't have an answer right away, we'll get it out to everybody in short order.
So we appreciate your time today to introduce this topic to us. We know it will generate additional questions as we continue to think about this. And superintendents, if you didn't hear me say earlier, for those of you that had to call in, we will send this. I think this is being recorded. We will send this as well as the video link and the PowerPoint slides for you so you can actually see those. And then I remind the superintendents and participants of our webcast on Tuesday, like we do every week, to discuss more specifics. And it was, as mentioned in the chat, a desire for clear, defined guidance for reopening schools. That's exactly what we're going to be providing. As I mentioned in other superintendent webcasts, that's going to be layered in with the initial guidance. And we are working closely with Public Health. They are working as hard as they can, as our folks at the department, to get you that guidance. So we look forward to that additional conversation. We want to thank you, Mr. Carter, and welcome to the team. And
Thank
for
you.
all the work you're going to be doing.
Thank you all for your time.
Thank you.
I believe that concludes the meeting, so we'll sign off now. Thanks again. Bye.